Gonna get started very soon. Welcome. Welcome, everyone. My name is Zaldy Tan. I'm the director for the Memory and Healthy Aging program at Cedars-Sinai, and a warm welcome to all of you in this Miracle of Living lecture. We are so glad to be here, my colleagues at Cedars-Sinai, and also for our colleagues here at Torrance Memorial for the warm welcome, and it's just such a great turnout. It's always a treat when we are invited to Torrance Memorial. As you know, Cedars-Sinai and Torrance Memorial are partners, so we share a lot of things together, so we're happy to be here and get to meet the patients who are so loyal and are served by Torrance Memorial. So it will be a very interesting evening, I hope you will find, and very informative. Just a few housekeeping messages. If you have questions, somebody will be going around passing a piece of paper that you could write your questions, and we'll be sure to collect them. And then before the end of the session, we're actually going to be a panel where all of the speakers will be sitting in front of the podium, and then we will be answering your questions. So think about questions as the speakers do their talks. Write them down, and then pass it on so that we can help answer your questions. But a special welcome to all of you here who attended in person, as well as those who are attending virtually online. So we are so happy to have you here. So I am glad to introduce our first speaker. Our first speaker is Dr. Anthony J. Chen. Dr. Chen is a board-certified in family medicine. He earned his Bachelor's of Arts degree in molecular and cell biology from UC Berkeley. He attended medical school at Drexel University School of Medicine before completing residency in family medicine at UCLA Medical Center. In addition, Dr. Chen trained at Harvard Medical School for physician acupuncture. So Dr. Chen will be talking to you more about memory and dementia. And so I would like to hand it over to Dr. Chen.
Thank you, Dr. Tan, for the introduction, and warm welcomes to everybody. Good evening. And I want to give special thanks to our Cedars-Sinai colleagues for trekking all the way down here to give us this informative forum. Tonight, what I'd like to share with you is the primary care perspective of what happens when patients or families raise concerns about memory or dementia. So by the end of the presentation, I hope to provide clarity about dementia, memory difficulties, and Alzheimer's disease to see how are they related and how are they different. So when someone presents with memory loss, our first thing what we want to do is to see if we can find an objective memory deficit. And if so, we want to quantify how severe is it. So the next thing is to find, are there treatable conditions that we can treat? And the goal really is to maintain independence and also preserve cognitive function. So there's a spectrum on memory loss. It's all happened to us before where we walk into a room, we're like, what am I doing here? Or constantly looking for my lost keys. And so is that normal aging? Or can it progress to something called mild cognitive impairment, which is a little bit more than normal aging, but not as severe as dementia? For dementia, we'll talk about the criteria for diagnosis. 60 to 80% of dementia cases are caused by Alzheimer's disease. There are about 25 to 50% of dementia are either caused or contributed by vascular disease, which, for example, stroke. The reason that they add up to more than 100% is that they're not mutually exclusive. As we age, there are more cases of Alzheimer's dementia, and there are more cases of stroke. So how common is dementia? This is a CDC data in 2022 in the United States. For our population of 65 and over, 4% has dementia. And as you can see here, age 65 to 74, 1.7%, have dementia. Between ages 75 and 84, 5.7% has dementia, and 85 and over, 13.1%. Unfortunately, this is one of the most significant risk factors is age for developing dementia, and it is also one of the non-modifiable risk factors. So the diagnosis of dementia, the reason I want to bring this up here is that most people think memory loss, dementia, Alzheimer's disease. So according to the Diagnostic and Statistical Manual, the 5th version, the DSM-5, we look at 6 different cognitive domains. Okay, so by definition, to diagnose someone of dementia, there needs to be a significant decline in one or more of the cognitive domains. The first one, memory, learning memory, that's acquiring information and retaining it. The second one is language, speaking, reading, writing, understanding it. Executive function is planning and decision-making. Complex attention, that's the ability to be able to focus and complete tasks. Perceptual motor, that is sensory information that we perceive, either visual, from sound, from taste, and then coordinate movements, such as seeing a clock face and be able to reproduce and then draw it back out. And the last one is social cognition, being able to recognize emotions, social cues, and empathy. So as you can see here, the definition is one or more cognitive domains. So in order to have dementia, one does not need to have memory deficits. This is a cognitive problem. So in dementia, one needs to have substantial impairment, and it needs to interfere with independence in everyday activities. We cannot diagnose dementia if someone is acutely in delirium. This is a condition, is a syndrome where in a very short period of time, especially in seniors who have multiple medical problems and they're in an unfamiliar surrounding, that they become acutely confused or incoherent. So, and also we cannot diagnose dementia if there's another mental disorder that can explain the cognitive decline. So a little bit here, the last 2 criteria here is a bit of a diagnosis of exclusion. So here you can see dementia is a cognitive impairment that may include memory impairment, but not necessarily so. So mild cognitive impairment, this is a lesser version of dementia. Instead of significant impairment, this is a moderate impairment, and patients are still able to be independent in their daily activities, but just with greater effort. So on the bottom here, you can see a progression where preclinical Alzheimer's disease, there's no symptoms, but maybe some biological changes. Then the mild cognitive impairment, where there could be very mild symptoms, but does not interfere with daily activities. And then we have dementia that interfere with daily activities, mild, moderate, and severe. There are other conditions that can cause memory problems. We talked about dementia, depression can cause memory issues, sleep apnea can cause memory issues, vitamin B12 deficiency, low thyroid conditions can all cause memory deficits. Stroke is one major cause, so we will talk about it later. Medications as well, more rarely neurosyphilis, and there are many, many more conditions that can cause memory issues. So not all memory loss is dementia, and some of them can be reversed and treated. So this here is a long list of medications that can potentially cause delirium or cause memory issues. And the reason for this slide here is not for you to see what they are. If you can read the prints here, I want to know who your optometrist is. Okay. So the reason I put this up here at the very top, these are very common medications. Analgesics, NSAIDs, these are Advil, Motrin, Aleve, naproxen type medications. Some of the antibiotics, patient favorites, azithromycin with Z-Pak. At the very bottom there, cardiovascular medication, beta blockers. These are like metoprolol, atenolol, carvedilol type medications. Under the gastrointestinal agents, H2 blockers, these are medications like Pepcid. And even over-the-counter supplements, St. John's wort, can also cause problems as well. So memory testing, we can refer patients for neuropsychological assessment, or in the office, we do simple tests, global screening scales, such as median mental status exams, Montreal cognitive assessments, and mini-cog testing. So moving on to Alzheimer's disease, by definition, at least 2 cognitive domains has to be affected. But by definition, one has to be a memory deficit. So to have Alzheimer's disease, not only there should be a decrease in cognition, but memory has to be affected. It needs to be a substantial decline, but the general presentation of Alzheimer's disorder is a very gradual onset with steady progression. So it starts very slowly and takes a while and gradually decreases with progression. So if we see someone who all of a sudden become confused or if they lost their memory, then we need to start looking for other causes and not say, well, this is just Alzheimer's disease. And again, no other neurologic, psychiatric, or systemic disorder that can explain the cognitive decline. So again, this points to the fact that this is somewhat of a diagnosis of exclusion. CTs, MRIs, and PET scans can help us diagnose to say, well, maybe this is more likely Alzheimer's disease if the imaging supports that and the clinical presentation is consistent with Alzheimer's disease. Unfortunately, at present, there's not one test that we can do to say, well, okay, this test is positive, yes, you have Alzheimer's disease. Vascular dementia. This is the cognitive decline due to stroke. This is the second most common cause of dementia after Alzheimer's disease. It can also frequently occur in combination with Alzheimer's disease, what we call mixed dementia. Now, when I speak with my patients, a lot of them, they say, well, I've never had any stroke symptoms, but there are large vessel strokes that presents with what we normally think of stroke, kind of droopy face, arm weakness, can't talk well, can't walk well, weakness, those kind of things. But there are also small vessel disease, especially in people with chronic conditions such as high blood pressure, high cholesterol, diabetes, particularly if they're not well controlled, then those small blood vessels get plugged up, and that's what we call lacunar strokes. And they may not present with our typical stroke symptoms, but all they do is knock out the memory if it happens at the right place and the right circuit. So typically it's a stepwise pattern where a patient will do well and all of a sudden an event happens, then the memory drops. And then they'll do well for a while and then something happens and the memory drops. That's what we call a stepwise pattern. Unfortunately, it is not uncommon to have depression after a stroke. So it makes it a diagnostic challenge when patients present with possible memory issues, possible Alzheimer's symptoms, and is this Alzheimer's disease? Is this a stroke? Or is it depression? Or is it a combination of all of them? So imaging, CT, MRIs, we use these imagings to look for potential other causes and also look for signs that is consistent with a prior stroke. Risk factors for dementia, age. Okay, so smoking, heavy alcohol use, traumatic brain injuries, and cardiovascular risk factors such as hypertension. To decrease the risk of dementia, we need to treat cardiovascular risk factors such as high blood pressure, high cholesterol, and high blood sugar. Interestingly, when they look at data where in countries where the cardiovascular disease decreases and cerebral vascular disease decreases, any causes of dementia decreases as well, not just the vascular dementia. Protective factors for dementia, stay mentally active, stay physically active, increase your social interactions, Mediterranean-style diet. This is a diet rich in fruits, vegetables, whole grains, beans, nuts, seeds, and a lot of fish, poultry, and very little red meat. Not coincidentally, this is also the diet that's recommended by the American Heart Association for cardiovascular disease prevention. Okay. Now, the last one here, education, is a little bit interesting. Multiple data have shown people with higher education tend to have a lesser incidence of dementia. And what happens is, what's postulated is that when we train our brain cells adapt and they branch out and they form more connections. And so it's postulated that patients with higher education, not that they're smarter, but they build up a bigger reserve. So it takes longer when they have dementia to be clinically apparent. But once they're diagnosed, the rate of decline, it's just the same as everybody else. Okay, so what is inconsistent to support the use of this is omega-3 fish oil supplements. Some data, some studies will say, yes, it's protective, some says no. And so there's not enough data evidence to say, well, we've got to do this to prevent dementia. So omega-3 fish oil, light to moderate alcohol consumption. Okay, so the point here is don't go home and start drinking a bourbon because it's not going to help. Okay, antioxidant vitamins, vitamin E, beta carotene, flavonoids, vitamin C, vitamin B6, B12, vitamin D, and folic acid. These have not been shown consistently to be able to prevent dementia. Ineffective to support hormone replacement, ginkgo biloba, non-steroidal anti-inflammatories like Advil, Motrin, Aleve, and Prevagen. Do not waste your money on Prevagen. The data on that, everybody asks about Prevagen. It's a very small study, and even the packaging says it does not prevent dementia, and it should be used in people without dementia. And so they randomized the two groups, only a little over 200 patients total, and half the group took Prevagen, half of it did not. And what they found is that they run tests, and in the Prevagen group, there are some people that did slightly better on some of the testing, and then they extrapolate that to say it can prevent and it would be helpful for memory. So hopefully there's not a Prevagen rep here today. Okay, so lastly, interesting slide, PET scan here. This is PET scan. They actually inject tracers and see what parts of the brain's active. When it's orange here, it is active. The yellow parts are intermediate, and the blue parts are less active. So on the left-hand side, you can see the normal brain, how it looks. And unfortunately, on the right-hand side, this patient with Alzheimer's disease, towards the bottom part, it's all blue, it's very inactive. Okay. Thank you very much for your attention. I really appreciate you being here. Thank you.
Thank you very much, Dr. Chen. That's really a tour de force presentation about Alzheimer's disease. So I'm sure a lot of you learned a lot about that, and some of you came specifically to learn more from Dr. Chen about Alzheimer's disease. But we are going to shift now into, I hope, something that is interesting to you, which is brain health. So what can we do now so that we don't end up having dementia, or at least reducing our risk or delaying the onset of dementia? So that will be the topic of the rest of this conference. How many of you have had forgetfulness? How many of you know someone with dementia? Right. So we're really preaching to the choir here, right? So we all our lives have all been touched by dementia. We've all had some episodes of forgetfulness. So really the goal here is to let you know what is normal brain aging and what are the things that we can do. You all look so young. Nobody looks to be over 27, but I bet you if I image your brain, some of your brains will look like this one on the closer to me than the other one on the right? So because our brains, just like all of our organs, age. We don't see it. You all look young, but if I get an MRI of your brain, I'm going to see there are areas that have decrease in size. There are areas of chronic wear and tear. So it's one of these things that is a reality of aging, is that just like any organs, our brains age, just like our hair turns gray or we get wrinkles. And that's what we're talking about here, is how to keep our minds healthy, our brains healthy, but also our minds healthy. This is the LA Philharmonic Orchestra conducting. And I always like to tell my patients that a healthy brain and a healthy mind is like a symphony that's playing, and everyone is in tune, everyone is in sync. If there's a person there in the back whose string is broken or is out of sync, you know the entire thing is messed up, right? Even though the rest of the orchestra is performing at their best. So the brain is like that. If you have a problem with, let's say, attention, even if your memory is the best, you won't be able to remember where you park your car. You won't, because you weren't paying attention, right? You weren't able to form that memory. So the brain is infinitely very, very complex and very, very interesting. And I hope we are able to impart you with some of the things that you can do to keep the music playing in your brain and keep the Alzheimer's at bay. So one of the things I want to mention about dementia and Alzheimer's disease, what we know is that it doesn't take just one hit. Most people who get dementia have had multiple hits. What do I mean by that? Someone, for example, may have been hit genetically. They have a family member who had dementia. So that's one hit. But that's not enough. Some people will also have poor diets. They're also not exercising. They love their alcohol. Perhaps they didn't wear their helmet and sustained a traumatic brain injury at some point. So most people who get dementia have more than one risk factor. And I think that's one thing that's hopefully empowering to us. Just because we have a parent or a sibling who had dementia doesn't mean that we're destined. Because there's a lot of other things we can do to tip the odds in our favor. It's just a slide looking at sort of the different known risk factors for developing dementia. You're going to hear more about each of these in greater detail: diet, exercise, sleep, social engagement, mental activity. What are the roles? What's the evidence that making these changes in your life could actually decrease your risk of developing dementia? At Cedars, we put together this hopefully helpful and easy to remember framework for improving your brain health as you get older. So B, blood pressure, rest, R is rest, A is for activity, both physical and social activity. I is intellectual stimulation, nutrition is N, smoke and stress. We'll be talking about each of these in depth, and hopefully at the end of this evening, you'll be able to walk away with some tips and tricks that you can use and start implementing as early as tonight or tomorrow morning when you wake up. All right, so I'm going to step off the podium for a while to hand it over to my colleague, Dr. Hiroshi Gotanda. Dr. Gotanda is an assistant professor at Torrance Medical Center. He's a geriatrician with expertise in memory disorders. He's seen many people for memory evaluation, but today he's going to be talking about lifestyle interventions for brain health. Dr. Gotanda.
All right, thanks so much for the introduction, Dr. Tan. Again, my name is Dr. Gotanda. I'm a geriatrician and also a researcher at Cedars-Sinai. So I'm going to talk about mainly cardiovascular risk factors to start this talk, because this area has been relatively well studied compared to other risk factors. So some people may not be familiar with the term cardiovascular. So cardio means the heart, vascular means blood vessels. And key cardiovascular risk factors include high blood pressure, obesity, high blood sugar or diabetes, and high cholesterol, and smoking. But these risk factors are well known for increasing the risk of heart attacks and strokes. But recent studies suggest that these same factors play a significant role in brain health as well. They cause damages to the brain that accumulate over 10 to 20 years. Especially important thing is often they don't cause symptoms. So it's crucial to manage these risk factors in your midlife, 40s to 60s. to reduce the risk of cognitive decline and dementia later in life. So in the next maybe 8 minutes, I'm going to talk about the latest research findings on how cardiovascular risk factors impact brain health. So first, blood pressure. Okay, so high blood pressure in midlife increases the risk of dementia by 1.6 times. Okay, but what exactly does a 1.6 times higher risk mean? So this slide might help you understand the magnitude of this number. So here we see out of 100 people with good blood pressure, 15 people develop dementia. On the right, among those with high blood pressure, the number rises to 24 out of 100, indicating a 1.6 times higher risk, because 15 times 1.6 equals 24. I chose numbers around 20 intentionally because by the age of 80, about 20% of people might develop dementia. All right, and how do researchers study this kind of connection? They typically recruit two types of patients, those with high blood pressure and those without high blood pressure. And they track these participants over a long time, like a decade or more, and see how many people develop dementia. And this study, all right, so in this figure, x-axis indicate years and y-axis indicate risk of dementia, proportion of those who develop dementia. And as you can see, the red group, those with high blood pressure, are more likely to develop dementia compared to those without high blood pressure over time. So this is a group without high blood pressure. And multiple studies have shown a similar association between high blood pressure and brain health. And one possible mechanism is that unnoticed small strokes that accumulate in the brain, so leading to long-term brain damage. And also, evidence suggests that dose-response relationship, so meaning the higher the blood pressure, the greater the risk. But the important point is that you have the power to take action and manage your blood pressure, and you can help protect your brain. Then what is the goal blood pressure then? So that the American Heart Association recommends a blood pressure goal of 130/80. So 130 is the systolic blood pressure, or the top number, and 80 is the bottom number, diastolic blood pressure. Some experts recommend even lower number, 120/80. But either way, keeping your blood pressure below this range is crucial to protect your brain. But who doesn't love ramen? I guess soy sauce and potato chips and bacon. But as you know, that these salty foods increases your blood pressure and can cause long-term brain damage. So please watch your diet. All right. Now, obesity. So obesity also in midlife also increases the risk of dementia by 1.6 times. So you may wonder, is this association simply due to other cardiovascular risk factors? Because after all, obesity is closely linked to other cardiovascular risk factors like high blood pressure. However, even after researchers account for these risk factors, obesity is independently associated with dementia risk. So one possible explanation for this is that excess fat tissue releases inflammatory chemicals, leading to long-term brain damage. And similar to high blood pressure, there's a dose-response relationship, again, meaning the more severe the obesity, the higher the risk. Okay. And this is a study showing that relationship. So x-axis indicate body mass index, or BMI, which is an indicator for healthy weight. And y-axis indicate risk of developing dementia. And if you look at the blue line, as the BMI goes up, so does the risk of dementia. But again, please know that reducing your weight, even modestly, can reduce the risk of dementia, and you can help protect your brain. Okay, a little bit about BMI. So BMI is a simple number calculated from height and weight. And many studies define obesity using the body mass index of 30 as a cutoff point. However, research suggested that Asian Americans face a higher risk even at lower BMI levels. So that's why World Health Organization, or WHO, recommends to use a different BMI cutoff for Asian Americans. So here, as you can see, 23 to 27 BMI is considered overweight, and more than 27 is considered obese. So actually my BMI is 24, so if I use traditional BMI cutoff, I'm within healthy range, but if you use BMI cutoff for Asian Americans, I fall in this range. So it's important to know this difference. Okay, diabetes. So midlife diabetes also increases the risk of dementia by 1.7 times. And the researchers believe that chronically high blood glucose damage blood vessels and trigger inflammation, leading to long-term brain damage. Also, the duration of diabetes matters. So this study examined the association between duration of diabetes and the risk of dementia. And then, as you can see, the longer someone has diabetes, the higher the risk. Okay. This highlights the importance of early detection of diabetes. But many people assume that only those who are overweight can develop diabetes. But actually, some groups, including Asian Americans, can develop diabetes even though they are not overweight. So it's important to note. Also, diets high in refined carbohydrate, like white rice, udon, white bread, we love, can cause blood sugar spikes, and it can increase the risk of diabetes over time. But the good news is that we can detect diabetes through screening. So if you haven't been tested for diabetes for a while, please talk to your doctor and get screened. All right, a little bit about cholesterol. High cholesterol or bad cholesterol increase the risk of dementia by 1.3 times, potentially due to increased risk of strokes and buildup of abnormal proteins in the brain. Also, statins, widely used to lower LDL cholesterol, may reduce the risk, but the study is still ongoing and we don't know yet. And smoking also increases the risk of dementia by 1.3 times. And potential mechanisms include strokes, small strokes, inflammation, the buildup of abnormal proteins, and the same as other risk factors. The more you smoke, the higher the risk, as you can see in the figure. But quitting smoking at any age helps, so consider quitting smoking if you smoke. All right. And taken together, following a healthy diet can reduce, following a healthy lifestyle can reduce the risk of dementia. So this is, for example, the American Heart Association recommends this Life is Simple 7 lifestyle, targeting cardiovascular risk factor I've talked about. And this study examined the association between healthy lifestyle and the risk of dementia. And as you can see, those who follow a healthy lifestyle have a lower risk of developing dementia. All right, so I encourage you to take a moment to, reflect on your lifestyle choices and take action to protect your brain health. Thanks so much for your attention.
don't know if I like Dr. Gotanda anymore. I say I can't have my ramen. I can't do all the fun stuff. But I'm going to take away another fun stuff, which is alcohol. Alcohol and dementia. So if you've been following the news, you've heard mixed things, right? You've heard that a glass of red wine with dinner is good for your brain. And that's been, you've heard that from your cardiologist, perhaps. Now the pendulum has kind of swung the other way, unfortunately. So it used to be thought that alcohol is actually good for your heart and your brain. Now it's kind of fallen out of favor. So what is alcohol anyway? Why do we feel good if you take a little, white wine or a little beer? It helps relax you, right? Because the reason is it activates this receptor called GABA. GABA is a receptor that kind of is a chill. It chills you out, kind of lowers your inhibition, kind of helps you relax. It's the same receptor, for example, that is activated or is suppressed by Xanax or Valium, right? Those medications that people take to kind of relax. So that's what it does, and it also, helps to decrease the glutamate. Glutamate is an activating neurotransmitter, so it helps you kind of, chill more, and also decreases the activation of your brain. So that's why we feel good when we take alcohol. However, the thing with alcohol is that, unfortunately, it is a neurotoxin, right? And why do we say it's a neurotoxin? Think about what effects excessive alcohol have in your brain. How do you know if someone's drunk or have had a little too much to drink? They become they lose emotional control. They become angry. They start crying for no reason, laughing for no reason. It's embarrassing, right, to be with someone who's drunk because they can't control their emotions. They can have blackouts. I don't remember. Did I embarrass you last night? I didn't know. I jumped in the pool. I didn't know that, right? Because it was your memory becomes impaired. Your breathing slows down. You get slurred speech. Your coordination. That's why you do the DUI, right? The police does the DUI because you lose your coordination. So those are proof. What I just told you is proof that alcohol is a neurotoxin. Fortunately, if you drink in moderation, that's just temporary. But the problem is if you drink too much and you do it for a long time, this is what happens. This brain is a normal brain. Obviously, this is post-mortem in the autopsy. If you have someone with Alzheimer's disease, this is what their brain looks like. You can see how it's a bit smaller and there's more spaces in between. And if you have someone with alcoholism, it's even worse. This is what alcohol does to your brain, excessive alcohol. Okay, so again, I'm not here to preach to say that nobody can ever drink again, but I tell my patients, choose your moments. Don't let, the concept of table wine is very popular, but I don't think people should just have wine on the table every meal. Again, the evidence doesn't support this to be a healthy habit. So you can celebrate important occasions, but I wouldn't drink alcohol every day. This is just to show you what problematic drinking is. A lot of people will say, certainly pregnant people shouldn't be drinking, right? But if you're not pregnant, then having a little bit of alcohol, 1 to 2 standard drinks per week. And on this side, you can see what a standard drink is for beer, cooler, wine, and spirits. But certainly there is excessive drinking, right? But there is no safe drinking per se. Depends on your genetics, depends on your general overall health, but just know that alcohol is not generally thought of as good for your brain. Another thing that's not good for your brain, especially for those of us in LA, is pollution. We had a lot of fires in LA, and I can tell you that air quality is really bad in LA. So pollution is interesting because what you breathe in, these pollutants, can actually get in your brain, right? Nobody knows why, nobody knows the exact mechanism. We just know that people who live in more polluted areas of the world have higher incidence of dementia. It's just a research finding. Nobody knows exactly why. In fact, if you map out the United States, and of course LA is over here, the dark area, the darker, the more polluted. Exposure to pollutants is associated with linear increase in dementia and Alzheimer's disease. And you know one of the greatest evidence that this is true? 9/11. Remember those images of those brave firefighters who are walking in when everyone was running out? Guess what? Many of them have dementia now. So this is a study just published this year, looking at over 5,000 World Trade Center responders. Some of them wear masks, some of them did not. Some of them were exposed a lot, some of them were exposed moderately, some people were not too exposed, and they followed them. A lot of them developed dementia before the age of 65. And the ones who are most likely to get dementia before the age of 65, guess what? Those who got very, very high dose of the pollutants that came from these buildings. So pollution is not good for us. What can we do about it? We live in LA. I don't know, air purifiers, maybe take a vacation somewhere where the air is better. I'm not sure, right? Or wear your mask. But just know that pollution is a risk factor. So this is just a graphic showing how much your risk of dementia increases as you are exposed to smoke, like recently we've all had in Southern California. So that's even more important to address all of our other risk factors. Fortunately, LA is not the most polluted city in the world. If you go visit India or Bangladesh, it's definitely more pollution there than here, but definitely something to keep an eye out. Next is hearing. So hearing loss is a silent epidemic. A lot of people have hearing loss and they blame everything but their hearing, right? You don't speak loud enough. Oh, the room is too noisy. Oh, speak up, I can't hear you, you know. But in reality, hearing loss is underdiagnosed. And it's been shown that hearing loss is one of the greatest modifiable risk factor for developing dementia. It's very scary. I don't know why, again, just like pollution, nobody knows why, but people with hearing loss, untreated hearing loss, have greater risk of developing dementia. If you have mild hearing loss, you have twice the risk. If you have moderate hearing loss, you have 3 times the risk. If you have severe hearing loss, 5 times the risk of developing dementia if you let it go untreated. So again, if you have problems with your hearing, get an audiology exam, get a screening, because this is something that you can treat very, relatively easily compared to other things. So think about it. So if you're misunderstanding people, if you're having difficulty on the telephone, you know how it is. Speaking loudly, you're turning up the volume. It's like, are you trying to wake up the whole neighborhood with your TV? That means that you probably have some kind of hearing loss. All right. This is just a graphic showing how many more, just like Dr. Gotanda said, if it's all about population, right? Not everyone who have hearing loss will develop dementia, but guess what? If you have hearing loss that's untreated, you have a higher likelihood of getting dementia, and you don't want that to happen. Vision. So vision, this is just one slide showing you that people who have vision loss are more likely to develop dementia. Not just Alzheimer's dementia, all-cause dementia, Alzheimer's dementia, vascular dementia. If you have vision loss, you are more likely to get it. And of course, the worse your vision loss, the more severe. Again, our brains crave information, whether through auditory or visual. If you deprive it of that for years, it's going to shut down. So you need to make sure your vision and your hearing are in tip-top shape. Head trauma. Guess what? Our brains don't like to be shaken, right? Sports, fall, being hit, being assaulted. And the interesting thing about TBI, what we call TBI, traumatic brain injury in medical speak, is that it peaks. There are 2 peaks. Once in your 20s because of sports, erratic driving, violence, but look at this. 70s, 60s, the fall risk for older people is very high, and this is something you do not want, I can tell you that. So if you're cycling, make sure you wear a helmet. If you're driving, make sure you wear your seatbelt. But beyond that, if you have a balance or gait problem, make sure you get yourself evaluated, because the last thing you need is to shake your aging brain or hit it. And there's a lot of ways to do that. And this is just studies. I'm not going to go over it in detail, but they followed vets, U.S. Army and Marine vets over years, and they found that 50 years after the injury, having severe traumatic brain injury defined as loss of consciousness or amnesia more than 24 hours, 4 times the risk of dementia. Mild cases, not very much increased. But again, protect your brain, try not to fall, try not to hit your head. And just to know that traumatic brain injury, you could be a direct hit, you get hit on the head, or you have a car accident and you hit your head in the windshield or the dash, or you can have blast injury, right, if you were in some kind of explosion. So there's a lot of ways to damage the brain, and this is what we see in the ER. Look at this guy. I don't think this guy's going to make it very well. So again, try to protect your brain. I'm not going to go over this in the interest of time, but just know, as I said, traumatic brain injury increases the risk of dementia. We are actually time is up. We do want to give you a break. I know that you've been very attentive and been very good to us in listening. We will have a Q&A question. We're all going to sit in the panel, so if you have any questions, write them down, and we will be sure to answer as many questions as we can. But right now we have a few minutes of break, so if you need a bio break or if you want to see more of the exhibits, please do so. How many minutes do we have, Mary? Okay, and then when you come back after your break, Dr. Emily Chang from Department of Public Health will talk to you about the initiative that the Department of Public Health have called Healthy Brain LA, a very exciting one. So, all right, we'll be back.
All right, thanks everyone for joining us tonight. I'm so happy to see such a great turnout. I met many of you when I was tabling outside. And I'd like to, again, if you haven't had a chance to stop by the table, just pick up one of the flyers with the QR code, and we'll talk about some of the resources that the Department of Public Health is offering. So I wanted to talk today about Healthy Brain LA. So I'm Emily Chang. I'm a geriatrician. I'm at the Division of Chronic Disease and Injury Prevention for the Department of Public Health in LA County. So many of us think of the Department of Public Health whenever there's an outbreak, a pandemic, but it's also important to realize that we also, our goal and mission is to keep our community healthy, safe, and informed. So we have a lot of work in our division around chronic disease prevention and management. So for example, we talked about some of the risk factors around dementia, around also tobacco control, injury prevention, nutrition. We also have a lot of people in our county, so we have a big charge. There's over 10 million residents, and they speak over 200 plus languages. We also have many residents who are age 65 and older with Alzheimer's, like nearly 200,000. And dementia is the second leading cause of death in our county. And many of us are caregivers. We may not identify as caregivers, but if you're assisting someone else or helping someone, you're a caregiver. And so it's important to recognize that we have resources to help and support you. 1 in 5 caregivers are specifically dementia caregivers, and there's resources through organizations such as Alzheimer's LA and Alzheimer's Association that are tailored to special needs. All right. Because today's theme is around Asian Americans and Pacific Islanders, I did want to add a slide with some statistics. So nearly 1 in 5 are older adults in our county. By older adults, I mean age 65 plus. And more than 1 in 10 have dementia. So I know that some of you had spoken with me about your personal experience with dementia, but in the public, a lot of people think that dementia is something really extreme, you're crazy, you're like totally out of the norm, but it's actually more common than you may think. If you think of a Chinese restaurant, for example, with those big tables that fit 10 people, chances are 1 in 10 of those people around you may have dementia. So this really reinforces the need to recognize the signs of dementia and get tested or screened and get connected to resources as soon as possible in treatment. So the number of older Asian American and Pacific Islanders with dementia is actually growing. So you can see here that when we compare by race and ethnicity in LA County between 2019 and 2040, the number of Asian American Pacific Islanders, the total number is projected to increase by 118%. So, I mean, it will change by 118%, so it'll increase by 18%, compared to non-Latino white or Caucasian, where it will be about the same. So because dementia cuts across, your health system, your insurance, where you live, and LA County is such a huge county, we really need some kind of coordinated response for the county. And so this is why in 2020, we at the Department of Public Health launched the program Healthy Brain LA to really put front and center dementia as a priority. So our program works to provide education and increase awareness about this important issue. And so we do this in 3 different ways, through health promotion and education, data collection and monitoring, and collaboration. And so I'll go through each of those categories one by one, but I just wanted you to be aware that a lot of our work is also focused on encouraging healthcare providers and policymakers to also prioritize dementia, because it's a very important issue, but sometimes it's a silent issue, like nobody wants to talk about it. So on the health promotion and education front, we do create our own educational materials, including some of the handouts that I had put out on the table outside. And we also have social media content as well to help people learn about dementia, including ways of lowering risk and resources for caregivers. So a lot of it reinforces the material that you already heard today. So you may have seen these flyers, brain health begins with your heart. So it's just really showing that a lot of risk factors is not like, well, I have this condition, but not this condition, right? A lot of the things that we can do can help multiple conditions, and that's why it's so powerful. So you already heard about eating right, moving, getting sleep, and controlling blood pressure. And then also we have a website that kind of compiles a lot of trusted resources from other organizations in addition to our own. So it's a great one-stop shopping kind of place that if you're looking for data or you're looking for health education information that's been vetted, this is a great place to look. And I'll show you the QR code again later. From a data collection and monitoring standpoint, we really want to understand the needs of our communities so that we can target resources appropriately. And we can see, okay, how can we help the greatest number of people? How can we get resources to the people that need it most? Right time, right place. And so we really want to help people who are not only living with dementia, but also their family members, their caregivers. And so it's also important to realize that we don't have all the available information that we would like to make decisions, but we try our best to collect the data, and then we also publish reports such as this one. What is the website? We will get there. I'm so glad that you're excited. We want to see traffic to our website. It's buried somewhere in the DPH. So that's why we really push our QR code so that you can access it directly. And then finally, for collaboration. So we do at Department of Public Health do not, in our division specifically, don't provide direct clinical or social services around dementia for the community, but we do work and partner with a lot of the organizations that do. So we established a coalition the Healthy Brain LA Coalition, where we and our partners come together and we created a strategic plan to kind of coordinate our efforts across LA County. And we also provide training and we also provide support for those other partner organizations so that they can better address dementia. So this is the QR code that I promised you for the Healthy Brain LA website. So I'm just going to take a second. If you have your phone and you want to scan the screen, that you can do so now. Okay, great. So the California Department of Public Health is also invested in dementia. So they had launched the Take on Alzheimer's public awareness campaign recently, and there's a lot of different materials available in multiple languages. If you read or speak another language, I do have some of the flyers out there on the table as well. And you can also visit their website, takeonals.com. So it's on the lower left-hand corner with the QR code, if you're interested. And so the purpose is to really promote brain health and encourage people to start the discussion. Because again, for some people, this is a shameful condition, or there's a lot of stigma around aging and dementia, and we really want to eliminate that. We're like, you know what, if you need help, we want you to be able to access the specialists that you need, the resources that you need, and I don't, please don't think that this is something shameful and shouldn't be talked about. And then finally, if you're social media savvy, I admit that I do not have an Instagram account because I am not technologically savvy, but thankfully my coworkers are. So if you have Instagram, you can search for our handle @ChooseHealthLA. You can also search for our content using the hashtag HealthyBrainLA. And so that's all that I have for you. Thank you.
Hi, good evening. I know it's been a long day. I'm the last presenter, so just bear with me for a few more minutes. I'm Sarah Kim. I'm a geriatric psychiatrist at the Cedars-Sinai Memory Disorders Program. And today, I'm going to talk about mental wellness, the importance of mental wellness, 心理健康, or 精神健康, 정신 건강, the importance of keeping mental wellness for brain health. And I'm primarily going to focus on 4 important factors to keep our mind well, and they are sleep, education or cognitive activity, social engagement, and management of depression. So first, let's talk about sleep. Sleep is actually divided into 4 stages: stage 1, stage 2, stage 3, and REM stage. Stage 1 is the lightest sleep stage, and stage 3 is the deepest or slow wave sleep stage. And it's in this stage, stage 3, the deepest stage, is that our brain actually gets a really nice wash. The toxins, the bad protein buildups, they actually get washed away when we are in the deep stage 3 sleep. Sleep naturally changes with age. As we get older, it takes longer for us to fall asleep. Our sleep duration gets shorter. We spend more and more time in the light stage and less time in the deep stage. And compared to the amount of time we spend in bed, the amount of time we actually sleep gets shorter and shorter too. So why is this important for dementia? So as our deep stage sleep gets shorter and shorter, as I mentioned, all the protein buildups, the toxin buildups that should be getting washed away, they don't get washed away properly, which actually leads to the development of dementia, such as Alzheimer's disease. So if we have more restless sleep, less time in the deep sleep stage, then we have more plaques or the bad protein building up around our brain cells. Our brain cells get more damaged, the toxins build up, and that can be a risk factor for dementia. So then what can we do about it, right? Of course, there are medications we use for sleep, but we all know that medications carry side effects too, right? So before we jump to getting prescribed sleep medications, there are very simple things all of us can work on to improve our sleep quality and sleep duration, and that's sleep hygiene. A lot of my patients ask me, are taking naps okay? They try to avoid naps, they think naps are bad, that it will further disturb their sleep at nighttime, but I actually tell them taking naps is completely okay as long as they're power naps, shorter than 30 minutes. If you take naps throughout the day, midday, it can actually replenish your energy so you can stay more active for the rest of the day, which will actually help you sleep better at nighttime too. So naps are okay as long as they don't go over 30 minutes. Another common question I get is how much sleep is a good amount for sleep, right? What's the perfect number of hours for sleep? It's different. All of us, we grew up with varying sleep hours. We function on varying levels of sleep hours. In general, anything less than 7 hours is considered short sleep, and anything longer than 8 hours is considered long sleep. So they do suggest that anywhere between 7 to 8 hours is considered good amount, but everybody's different. Whatever has been your norm, for you to function, for you to feel well rested when you get up in the morning, that's your perfect sleep hour. There are environmental modifications we can work on to improve quality of sleep. Keep your bedroom quiet, dark, keep the temperature comfortable, reduce any stimulation during the night. There are also factors that can disturb sleep, right? A lot of us have sleep apnea, we suffer from pain, nocturia, we have to get up and use the bathroom frequently throughout the night. Some of us have restless leg syndrome. All these factors can further disturb sleep, so getting good control of these factors will improve the quality of sleep. It's important to keep consistent sleep schedule. Go to bed at the same time. Try to go to bed at the same time every night. Try to wake up at the same time every morning. Consistency really carries far when we want to improve sleep quality. Use the bed only for sleep. Don't lie there pondering, wondering, stressing when you can't sleep. The more time you spend looking at the clock and wondering why you can't fall asleep, you will have a harder time falling asleep. So if you really just can't go to sleep, get out of bed, do some walking, do some stretching, drink some hot water, or do some, listen to music, and then try to go back to bed when you feel like you can try to go to sleep again. Our brain has tendency to connect actions with places, so the more time we spend turning and tossing in bed and not sleeping, our body will and our brain will get used to doing that activity again and again in bed. So make a connection, use the bed only for sleep. Try to exercise, try to stay active during the day, mentally and physically. That will, help your body unwind and have easier time falling asleep at nighttime. There are some activities you can do before you go to bed to relax and unwind. You can do some yoga, stretching, meditation, journaling, listening to relaxing music. There's a 10-3-2-1 rule I share with all my patients. I know it's easier said than done. The 10-3-2-1 rule goes: no caffeine 10 hours before bed, no food, no eating or drinking, including alcoholic beverages, 3 hours before bed, stop working mentally and physically 2 hours before bed, and no screen time, no TV, iPad, iPhone, Kindle, whatever, no screen time 1 hour before bedtime. And these are, easy things to do before we jump to taking hypnotics or sedatives or sleep medications. Next, I'm going to talk about education or cognitive activity. So true or false, IQ is associated with dementia? Is IQ associated with dementia? I think Dr. Chen briefly mentioned this in his talk. How smart you are, your intelligence level doesn't really have any association with dementia, but the level of education actually does. This is quoted from many studies. Higher educational background has a reduced dementia risk. Educational attainment, not years of education, appears to drive this protective effect. For Chinese, Filipino, and Japanese Americans, attaining a university degree was associated with decreased dementia risk. So we all should have listened to our parents when they told us you have to go to college, right? And not just education, but occupational complexity was also found to be associated with decreased or delayed risk of dementia. So what does this mean, right? If how smart you are is not associated with dementia, then how is your educational background or your occupational complexity associated with dementia? So if you have high cognitive stimulation, it helps build high cognitive reserve, like Dr. Chen mentioned. So you have more reserve to utilize before dementia hits you. The higher use of brain can promote better repair efficiency and less decline of the brain networks. And if you have a higher educational background and high salary occupation, chances are that you have improved financial situation, which leads to more resources, better choices, better house, better neighborhood, less pollution, better diet, things like that. So then what can we do? It might be a little too late to go to Harvard. It might be a little too late to get a license and get a new job, right? Does that mean it's over, it's done? No, there are so many things that we can still do and we can continue to do to stimulate our brain. And those are cognitive activities. You don't have to look for hardcore expert Sudoku for cognitive activity. Anything, even a game of mahjong or card game, any puzzles, or even just coloring activity, anything that really stimulates your mind and stimulates your cognitive function can be helpful to decrease the risk of dementia. And next, I'm going to talk about social isolation. Dementia risk was higher in people who were more socially isolated. Why? The people who are living alone, who see people, who see family or friends less than once a month, who are not involved in any group activities, had high risk of dementia. So they encourage that you engage in social activities, enroll in social classes, go to that senior center, call up your friends, see your family more often. That will help build cognitive reserve by stimulating your brain. If you have more social gatherings, social activities, that actually promotes healthy behaviors. And it's a great way to reduce stress, which will reduce inflammation in your brain too. Social isolation doesn't always mean loneliness, right? You can be engaged in all kinds of social groups and activities and still feel lonely. And loneliness is one of the most prominent symptoms of depression in older adults. Depression and dementia really go hand in hand. You can see how many ways depression can actually increase the risk of dementia by increasing levels of stress, increasing the protein buildups, causing brain shrinking, causing nerve cell damage, and things like that. And so depression increases the risk of dementia, but dementia also increases the risk of depression. Depression can double the risk of developing dementia, and about 40 to 60% of people with dementia were found to have depression as well. When I bring up the topic of depression in my patients, a lot of people, they just flat out deny it. I'm not depressed. I'm not a depressed person. I'm not sad. I never cry. I'm not depressed, right? But we have to understand that depression, especially in older adults, it doesn't always mean you feel sad or you're crying. It can actually manifest in many different ways, such as just feeling numb, not having any emotions. It can actually manifest in physical complaints too. If you all of a sudden have a lot of pain everywhere, you're hurting everywhere, or you're just tired, you have fatigue. or you feel empty, or you have early awakening or multiple awakenings throughout the night. If you have just variations of mood, your mood fluctuates. You're not necessarily depressed, but your mood just changes all of a sudden. You can feel worthless, helpless, or hopeless. Those can all be symptoms of depression. So because depression is associated with very high risk of dementia, we always need to watch out for any warning signs, not just in ourselves, but in people around us, right? Sometimes we don't know what we're going through when we are actually in depression, and that's why it's important that the people around us catch the warning signs too. And these include low mood, crying spells, just irritability, not sadness, but just feeling irritable, having short temperament, loss of interest in doing things, changes in sleep, changes in appetite, having low energy, fatigue, social withdrawal, feeling numb, feeling hopeless or helpless, feeling worthless, feelings of guilt, or having any cognitive changes like poor concentration, or having any thoughts of death. These can all be warning signs of depression. And again, the theme is I'm not a pill pusher. I'm not always asking for or looking for medications when I see patients with depression. You don't always need medications when you're struggling with depression. There are, again, lots of simple things that you can do to manage depression. You can work on reducing stress by engaging in social activities, increasing your support network, working on your sleep hygiene and improving your quality of sleep, exercising, changing your diet. These all can help with depression. All right, thank you.
All right, may I ask our speakers to sit on the hot seat, because we have your great questions. By the way, we didn't, because Dr. Kim and just spoke, so make sure that you have questions for Dr. Chang and Dr. Kim. Just write them down and then just pass it to the front and I will come and get them. All right. Kanisha, do you have something to? Okay. All right. All right. This is the Q&A section, and I will moderate. Thank you very much for the great questions that you have submitted. I will start by. Okay. Let's start with our first speaker, Dr. Chen. So if a person is diagnosed with mild cognitive impairment, is this information provided to the DMV or other governmental agency?
No. The answer is no. By definition, mild cognitive impairment is very minimal in terms of symptoms, and it does not affect daily activities. So no, it is not reported to anybody outside of staying in your medical records.
That's absolutely correct. I think the one thing that is worth noting is that California is a mandatory reporting state for the Department of Public Health and the DMV. So if you have dementia, not mild cognitive impairment, because MCI is not yet dementia, but if you have mild dementia or moderate dementia, just know that your health professional who made that diagnosis is required by law to report. That's just California law. But they may not do it. They may not do it, but that is the law. But not mild cognitive impairment. Okay, question here for Dr. Gotanda. Are some diets more protective than others, like Mind diet, Mediterranean versus vegan? And there's another question here that's related. Are vegan diets better at lowering dementia risk? Are low-fat diets better at lowering dementia risk?
Sure. So Mind diet has the most, I guess, evidence-based diet. So it's based on the Mediterranean diet and DASH diet. The DASH diet is for blood pressure mainly from like fruit and vegetable-based diet. So yes, the mind diet would be the best diet to follow. Vegan diet may be helpful in terms of the cardiovascular risk factors I mentioned, but it might lack the vitamin B12, and lack of vitamin B12 might be associated with memory issue. So I would be careful about that.
Okay, thank you, Dr. Gotanda. I'll answer the next question because this is about hearing. And the question is, what are the interventions for hearing loss? Drugs, hearing aids, and how do they improve brain health? So hearing loss, the solution, first of all, you need a diagnosis, right? Because it depends on the type of hearing loss. Not all hearing loss is the same. Besides mild, moderate, severe, the severity, there's also, is it high pitch or low pitch? What kind of hearing loss do you have? And the only way to do that is through an audiologist. The audiologist will make you hear different tones of sound, and by the end of that, they will have something called an audiogram that tells you what type of sounds you have a problem hearing. Like, is it the range of human hearing, or is it music, or is it, other things, right? So, and then after that, they will be able to prescribe to you a hearing aid. And when you think of hearing aid, I know we think about this very massive thing that's very unsightly, very embarrassing. But now the technology has gone so far that there's actually hearing aids that even go in your ear that you don't even see it. There's Bluetooth hearing aids now that you could get that will even help you listen to music and things like that. There's even over-the-counter hearing aids now that you can get for if you don't want to spend too much money or just want to try them out. But the most important thing is get an evaluation, because if you don't know that you have a hearing loss and then you let it go on for years, that's actually not a good thing. Okay, let me ask a question to Dr. Chang. Will lifestyle improvements after, say, age 85 or 90 reduce the risk that were discussed from a Healthy Brain LA standpoint?
I feel like I'm being quizzed. So one of the questions is, as you get older, and my oldest patient is over 100. So there's a lot of questions like, after a certain age, do you have to care about any of this anymore? And I really want to advise you that just because you're aging doesn't mean that there's like an expiration date. So it's always important, to keep learning. I saw this sign the other day at Ganol Lumber. They said, never stop learning because life never stops teaching. So I say all the lifestyle intervention, everything, all the risk factor reduction tips that were shared with you today, please continue. No matter how old you are, it's important to realize that you can still gain benefit, especially like blood pressure control to prevent stroke. I do have patients who are older, never had a stroke in their life, now having a stroke at age 99, right? So it's never too late to have a stroke. And the same thing with heart attacks and things like that. So anything that you can do can really help. The other thing I would mention is some of the guidelines, though, do change as you get older because they're a little less strict, because the more strict you are, so for example, diabetes control, the more strict you are, you might actually cause yourself more harm. So it's important to talk to your primary care doctor who can tailor the recommendations to you.
Thank you, Dr. Chang. So what you see on your screen is a QR code. This is different from the one that Dr. Chang showed. This is a little survey that we put together just to get to know your attitudes about memory and dementia. So if you don't mind just taking your smartphone, for those of you who have a smartphone, and just take your camera, put on your camera, and that will take you to the website. And if you don't mind answering it, it'll be just a few minutes, maybe not more than 5 or 10 minutes to answer this survey, and we can do that while we are answering these questions. Okay, the next question is for our psychiatrist, Dr. Kim. How do you get rest when aging causes multiple night bathroom calls?
Yeah, it's a great question for a psychiatrist, right? I think so. If you have a lot of bathroom visits during the night, I think you should always discuss with your primary care doctor. There are medications that are prescribed to help with nocturnal urination. And there can be other factors causing why you have to pee so much throughout the night too. So make sure that you always discuss that with your primary care doctor. Like I mentioned, environmental modification really helps. Keeping your room dark and quiet, no stimulation, and really working on sleep hygiene. That does, it might not necessarily solve the peeing problem, but it can actually give you more restful sleep and improve the quality of your sleep.
Also look on the internet, bladder retraining program. Very simple to do, and it's free. You can do it yourself. And also Kegel exercises can help. Just be careful with some of the bladder medications because they can affect your memory.
Great. Thank you for those great responses. All right, next question is back to Dr. Chen. Which doctor will help diagnose, analyze memory issues? It says seeing primary care doctor.
Okay, so when it comes to memory, it really depends on the initial evaluation to see what are the potential causes. So the causes could be very different. If someone who has an irregular heartbeat that keeps having strokes because they have blood clots coming from the heart, the treatment really would have to come from the cardiologist. But if it's just a pure memory issue, typically after seeing a primary care physician, they would be referred to a neurologist. And if there are some psychiatric issues that's confounding, then they may be referred to a neuropsychiatrist.
Great, thank you, Dr. Chen. All right, back to Dr. Gotanda. Dr. Gotanda, is a higher BMI, let's say 30, when older, like if you're an 80-year-old female, is that healthy?
It's I wouldn't say healthy. As they mentioned, I try to be follow a healthy lifestyle, then try to lose a little bit more weight. Although I think I heard evidence showing that somewhat overweight is okay or might be better than too much skinny situation. So the overall answer is it's not healthy, but I'll try to lose a little bit weight, but not too much weight.
Yeah.
It's kind of complicated.
Okay, thank you. All right, the next question is for me because it's asking about smoking. Actually, this is for Dr. Gotanda again. Is smoking marijuana worse than cigarettes?
I would say so, but I'm not sure. I guess I'll defer that to other speakers.
Yeah, I think they both are bad, but anything mind-altering substance like cannabis can actually produce more harmful effect on the brain. Smoking will increase dementia risk by increasing blood pressure, cardiovascular, heart risk factors, things like that. But marijuana, on top of that, it can alter the brain chemicals too. It's a mind-altering drug. So I would say it can be worse than smoking nicotine.
Great, thank you. Next question is for me. An attendee is asking about where I got the statistics for alcohol drinking. Remember that slide I showed with the number of drinks per week? That doesn't mean that that's for things like alcoholism, things like cirrhosis, but that is not necessarily with the brain because nobody knows how much or how little alcohol is safe for the brain. Nobody has done that study yet, but what we know is that because of the neurotoxic effect of the alcohol on the brain, that probably any amount of alcohol is not good for you, but is it going to cause dementia? Nobody knows, right? But we know that excessive alcohol, if you're in the alcoholic range, then you saw that slide of the picture of the brain I showed you with the atrophy of the brain. But right now, in 2025, we don't know what alcohol intake is safe for the brain and what is harmful. So we don't have that information yet. Okay, Dr. Chang, are drugs and supplements, drugs and supplements may have side effects on cognition. What can you say, Dr. Chang, about drugs and cognition?
I'm so glad that you asked that question, because the number one thing that a geriatrician does when they see a patient is review the medication list. So there are lots of medications out there that can affect your memory. And so sometimes it's not your fault that you can't remember. It's because of the medications that were prescribed to you. And if you have multiple specialists, the effect can be magnified, because there's multiple cooks in the kitchen. And sometimes the drugs can interact. Trying to treat one problem and you fall into a different problem. So I mentioned there's certain drugs that have what we call anticholinergic effects, so you can also look that online. As far as, so we talked about bladder medications as some, like Benadryl, or like some of the dizziness medications, those are common offenders. Also another class is like opioids, are very strong pain medications, can also affect your memory. As well as benzodiazepines, which, if you need to use it, obviously Dr. Kim has a lot of experience with using it with patients who need it. But if you don't necessarily need it, it's better to avoid it. So there's a lot of, in geriatrics, we like to think about, we have to balance risk versus harm. And so that's also very important, is that if you ever have a question about your medications, please speak to your pharmacist as well. As far as supplements, I ask my patients to bring in the bottle, because sometimes they say, oh, I take this sleep aid, or I take, this supplement to improve my nerve pain or whatever, and I have no idea what's inside of it. So unless they bring it to me and show me the label, I can't help. That said, I do have to do research on some of these things. So one of my patients actually took me up on my offer. She brought her sciatica medication, and a sciatica supplement, and I looked at it, and I looked up every single herb in it to see what it would do. So yes, that is something that you can do, and I would encourage, like, bring all your medications to every visit.
Great.
I just wanted to add, just because they're natural supplements doesn't mean that they don't affect your body. They all go through the liver, and that can interfere with how your liver processes and clears your prescribed medications. So you can actually get toxic from your prescribed medication if you are taking some kind of natural supplement that actually blocks the enzyme that processes that medication. So it's really important to tell your doctor all the supplements that you're taking.
Good point. Just because it says natural on the label doesn't mean it's safe, because it has interaction. I always joke with my patient that cyanide is natural too, right? And we probably don't want to be taking that. Anyway, okay, so Dr. Chen, this is another question for you. Do you advise taking a scan of the brain, and at what age?
Okay, that's a good question. One of the things I want to kind of convey is that unfortunately, most of the things we do in medicine are not black and white. And so it depends on the situation why we would consider a brain scan. For example, a CT scan could potentially be harmful for someone who's at low risk, where they get a lot of radiation exposure. So if we order a scan, it would really be selecting the right patient under the right circumstances, doing it at the right time, to either rule in or rule out what we're thinking. So the scan really is there to supplement, to confirm or disprove a diagnosis, rather than using the scan to diagnose dementia or Alzheimer's disease, for example. And so one caveat also is that oftentimes in imaging results, we could have a perfectly normal patient with an abnormal, a very abnormal looking imaging, but they're fine. But what do you do with that? The other thing is that we can have patients who have severe illnesses and their imaging are normal. And so what do we do with that imaging result? So we've got to be careful. Everything's all about risk and benefit ratios. And so imaging is also included in that. So far, there's not a standard guideline as to, well, screening for dementia. What tests do we do? What imaging do we do? At what age? And what interval? So we don't have that guidelines, and everything has to be evidence-based as well.
Thank you. Next question is for me. Somebody asked, what is PM 2.5? Sorry, I didn't go through the pollution because we didn't have time, but PM 2.5 is the fine particulate matter. It basically means that it's less than 2.5 micrometers. So that means that it can be inhaled very deeply into the lung because it's a very small particle. And these are the things that you can get from vehicle emissions, from power plants, from burning houses. So those things are the ones that have been most correlated with risk, not just of dementia, but cardiovascular disease, stroke. Pollution definitely is a big issue, lung cancer, et cetera. So, and then the NO2 is nitrogen dioxide, right? This is the reddish tint that you see when you see the picture of LA mostly. The smog, those are all, they hang in the air. So those are also from vehicle emissions and the same sources. And then ozone is trickier because ozone is naturally occurring. It's not necessarily bad for you. In fact, ozone, can reduce UV light exposure. But man-made ozone from all these pollutants can also be bad for you. So the important thing is just to try to stay away from pollution. Like if you see that the air quality index is bad that day, maybe instead of taking that hike, you might want to exercise indoors and let the air get better a bit. And then air purifiers are always helpful in the indoor space. So that's really the message. You can't really avoid air pollution per se, but at least minimize your exposure. Okay. This is a question that they directed this to Dr. Kim, but I don't know if you would like to answer this. Could MSG consumption, because it's an excitotoxin, be the reason for more issues in Asian population? I guess more dementia issues in Asian population is what it means?
To be honest, I don't really know a lot of background information of MSG related to neurotoxic effect.
Yeah, I don't know. Does any of our panelists know too much about MSG? I personally don't know too much. I consume it, but I don't know too much about it. All right, I think you stumped us, whoever asked that question. We need more research on that. Okay, we have about a minute left. Let me see if I could dig. I guess we could just spend the last minute just having our panelists give their parting comments on this night because we discussed so much, we tackled so much, we learned so much this evening. Maybe start on that side with Dr. Gotanda. Like, what is your main message if these were your patients saying, Doc, I just want to keep my brain healthy. What's the one or two things that I can do?
All right. So, sorry. So as I mentioned, yes, you can achieve healthy lifestyle or address cardiovascular risk factors thing at the one doctor's visit. So I would say just keep those risk factors in mind, then get screened. High blood pressure, cholesterol, and diabetes. So that's my take-home message.
I always tell my patients, just be happy. That's what matters the most at the end of the day. I think we forget to give ourselves a lot of credit sometimes. The reason why I love working with older adults is because you guys have so much resilience, right? You guys have so much wisdom, so much resilience, and sometimes, when we get sick, when we get older, when we start to lose some of the things, we forget how strong, how successful, how strong of a person we are, right? So I just want to remind that give yourself a lot of credit. You can do a lot more than you think you can do.
It's working.
Yeah, and just be happy.
Okay, I would just recommend, just eat healthy, exercise, enjoy life, stay socially connected. If you have any questions, make sure you bring it up to your primary care physician or your other physicians. When there's any issues that you feel like there may be memory issues, any problems that you have, I would recommend check it out. early. There may be a lot of things that we can do to reverse the course, and don't be too anxious or nervous, because like we talked about, not all memory problems are non-reversible. There's a lot of things we can do to help you. Thank you.
I just want to echo what everybody else has said. You have a lot to offer, and I really encourage you to pass on that wisdom to the next generation. And Gen Z, they need your help. Yeah, and the other thing I also wanted to mention, I totally agree with Dr. Chen. Please don't wait until the next visit to tell us about your problem. I really empower you that it's our honor to serve you and help you. And so anything that you need, like it's team-based medicine now. There's no longer like, oh, this is this person's job, this is this person's job. We all work together now. So just please don't be afraid to ask for help.
Great parting thoughts for our panelists. For my part, I just say, know your family history and know what your vulnerabilities are. So you can say, oh, my friend smoked like a chimney, he drank, like there's no tomorrow, and he didn't get dementia, so I'll do it the same. You're not the same as that person. So not everyone can get away with everything. So get as much to know about your own history, your vulnerabilities. When people ask me about reducing the risk for dementia, I show them the chart showing that 55% of the risk of Alzheimer's disease is genetic, 45% is environmental or lifestyle. So if you already have a parent, a sibling, multiple family members who have dementia, you know that you don't have as much wiggle room. So all the more reason to choose a healthy lifestyle. And this is sort of the summary of everything that we talked about today, about the risk factors for dementia. So try your best. Not everyone, pick your poison, as they say. Not everyone will be stellar at everything. We can't pick our parents, for example. But just try your best to knock out or make sure you take care of these risk factors as much as you can. I just wanted to have a little plug for our center, the Goldrich Center at Cedars-Sinai. Thank you for all of those who signed up for our research programs, who ask about the programs, the clinical programs that we do at Cedars. And thank you to Torrance Memorial for having us. Just know that we have a lot of programs at Cedars as well as here at Torrance Memorial. We also have a memory and healthy aging program, which is about risk reduction for people who do not have dementia, but want to know about their risk and how to reduce their risk. We see people 40 years old and older who have family history or are worried about their risk, and this is at Cedars-Sinai Medical Center. And then finally, I just want to thank our team in our neurology department, memory disorders program. You've met some of them, many of them who are out there manning our booths. So thank you very much for saying hello to them, and thank you to all of them. And again, a very thank you to Torrance Memorial, to all the hospitality, and it's a pleasure to be here with you. And hopefully we will be invited back soon to give you more health talks. Thank you very much for attending.